Hello, I'm Dr. Sarita Pawar, a GP in Cardiff, and I'm going to be talking about macrovascular complications in diabetes. Now, diabetes is a chronic, complex disease with long-term crippling complications and death. Diabetes is mainly, which is associated with high blood sugar, is on the increase. In the UK, we currently have about 4 million. And globally, we've got about 400 million, which is on the rise and doubling. And in 20 years' time, we should have double of that. Mainly caused by the absence of insulin or lack of insulin. There are two main types. You've got the type 1 where there's no insulin at all. And you've got the type 2 where there is insulin, but because of resistance, it's not utilized by the body. Now, before discovery of insulin in 1921, diabetes did cause a lot of early deaths, diabetics living not beyond 30. But it's not so now, because although with diabetes it's inherited and some races are more prone to it, it is purely preventable. So I'm going to be talking mainly about the effects of the high sugar in diabetics, that the negative effects that it has on blood vessels. In the small blood vessels, it can affect the retina, and it can affect the kidneys, and it affects the peripheral nerves. But when we talk about macrovascular, that is the medium and the large size blood vessels, the high sugar levels due to chronic inflammation causes atherosclerosis, or that is thickening and hardening of the arteries. Now, this also causes plaque formation, and with this it causes reduced blood supply to the organ supplies. Now, the vital organs affected by the macrovascular complications or the effects on the macrovasculature to the heart, to the brain, and to the lower legs cause, in the heart, it causes the coronary artery disease, and it causes fatal and non-fatal heart attacks and heart failure. Now, in diabetics, you can get what you call silent MI or silent heart attacks. In the brain, when the vessels of the brain are affected, it causes strokes. One has the risk of getting strokes and vascular dementia. In the lower limbs, reduced blood supply to the legs causes, and especially if there is peripheral neuropathy, or if the peripheral nerves are affected, little minor trauma can cause infection. And if this infection does not heal, then it can cause life-threatening infection and eventually needing amputation. Now, diabetes is the commonest cause of non-traumatic amputations. So coming back to diabetes, it is preventable as long as we treat the risk factors. The risk factors are the high sugars, high blood pressure, and the high cholesterol. So these are treatable with additional modification of the risk factors, such as diet. Make sure that you don't have diet which is going to be causing high sugars, lean meat, complex carbohydrates, and fruit and vegetables, berries, strawberries, melons, etc. are good. Exercise, you need to do at least 30 minutes of exercise 3 to 5 times in a week. And the most important of all is to stop smoking. So with diabetes and macrovascular complications, it's not all doom and gloom, because if you look after your health, if you make sure you exercise, if you make sure that you keep your weight within normal, and make sure that you control the blood sugars, then there's no reason why you cannot have a long, healthy life. So thank you very much for listening. Thank you.